Hi, everyone. If you're just joining us, this is a webinar by the NCCDH and the Canadian Poverty, Health Equity, and Climate Change Initiative. And we'll just get started by welcoming you all and saying that this webinar is called What are the Connections Between Poverty, the Climate Crisis, Women's Health, and Health Equity? And how are these issues framed in the media? And we're going to be exploring opportunities for action. My name is Pema. I use she, her pronouns, and I'm a knowledge translation specialist at the NCCDH. I am joining this webinar from CPHECC, which you likely also know as Montreal, on the traditional and unceded territory cared for by the Kainakahake people. And the NCCDH is located in another area of this wonderful land, and it's located in Mi'kmahi, the ancestral and unceded territory of the Mi'kmaq people. As I share these land acknowledgements, I'm also reflecting on the fact that this topic, the climate crisis and how it affects women and gender diverse people who are experiencing poverty, cannot really be disconnected from histories and legacies of colonization and racism and other forms of oppression. And so I'm really looking forward today to helping to unpack that with our speakers and with all of you. I'm just also going to pause here to say that if you haven't already done so, we do have a chat box. Feel free to introduce yourself in the chat box. We love to hear where you're joining from, the kind of work that you do. You can share comments and resources or opportunities during the webinar. And for anyone who wants to ask questions, we ask that you use the Zoom question and answer function rather than the chat box. There's a button at the bottom of the screen. You might have to click something like more to get to it, and then it'll say Q&A. And you can feel free to ask your questions in French or in English because I'll be able to understand them. Today, we do only have a short time together, and this is a series of really complicated, complex, interconnected topics. So we're taking a bit of a different approach with this particular webinar. Rather than just sharing information about one piece of research or an initiative, we're creating the opportunity with all of you for some critical reflection and discussion. And we hope that you'll lean in with us through the chat box, through the question and answer function on Zoom, and through interactive polls and really kind of get into that together. And you can interact also through, there's going to be a note in the chat box through a platform called Slido, which we use for those interactive polls. And this works best if you have a cell phone, so you can scan a QR code to answer in real time. At the same time, you can also just join from your computer if you want to open another browser window. There are instructions in the chat box. So during our time together today, we hope to, the first piece is to increase awareness about these intersections, about how are poverty, the climate crisis, women's health, and health equity connected. The second is to begin to analyze how issues related to poverty, the climate crisis, and women's health are framed in the media, and highlight opportunities for action through research, policy, and practice. I use the words begin to because there's really a lot to explore here. And I think if there's appetite for a follow-up conversation after this webinar, just let us know and we'll do our best to accommodate that. I mentioned earlier that this webinar is a partnered effort. The NCCDH has been collaborating with the Canadian Poverty, Health Equity, and Climate Change Initiative. And I'm going to turn things over to Dr. Sean Kidd at the Center for Addiction and Mental Health, and he's going to tell you a little bit more about himself and about this work.
Hey there, thanks so much, Pema, and great to be here today. I'm just going to speak for just literally a minute and not get in the way of the main part of the presentation. I did share a link as well in the chat, but basically our organization has sought both globally as well as nationally to bring together experts, including lived experts in the area of poverty, climate change, health, and well-being, really kind of tackling the fundamental problem that there's a lot of sort of general high level recognition that poverty is a key factor in considering the threat multiplying impacts of climate change. But what we've really lacked are the details, what's happening in people's lives who have different intersections of identity and experience. And until we get into those details and understand what's happening, it's going to be very hard to generate responses and to promote health equity at the end of the day and track and see if whatever we do is actually making a difference. So this is one facet of our work, which brought together a wonderful group of learners and leaders. And with that, I'll hand it back to you, Pema.
Thank you. So yeah, and everybody's going to get a recording of this webinar, so you can always find that QR code or the links that are shared in the chat box through whatever we communicate with you afterwards. And thanks so much for that information about the initiative, Sean. I'm just very quickly, like Sean, going to say that if you've joined our webinars before, you'll know that the NCCDH is one of 6 national knowledge translation organizations. We each work across Canada. We each support the public health system in different ways and in different topic areas. And you can learn more about all of that work at nccph.ca. The center that I represent, the NCCDH, has a vision that's very much in line with this webinar's focus. We envision that all people and communities experience a dignified and healthy life in relationship with each other and the planet. And our mission is to support the Canadian public health, and the community of Canadian that is within Canadian public health is able to address the structural and social determinants of health and advance health equity for all. So we see ourselves as supporting that work. So without further ado, I want to turn to all of you. And by this, I mean both our speakers, who I'll introduce in a moment, and our participants, to kick off our discussion with a poll, an interactive poll. So this is where you get out your cell phone and scan a QR code or open another browser window on your computer and follow the link in the chat box. I want to know more about what concerns you. What are your health equity concerns or topics that you know about? What are those systemic, avoidable, and unfair problems that affect women who are experiencing both poverty and the climate crisis? And this is going to show up in a word cloud. So words like power, that I'm seeing here in real time, work really well. Something that's 1 or 2 words works really well, and you can reply as many times as you want. Great. And as these responses come in, I'm going to just say that we have some really great people participating from all across Canada. I looked at our registration data and I noticed some of you are joining from research or academia, from roles in the health system and in government, from public health organizations, community organizations, not-for-profits. So I think we're going to have a good range of answers here. All right, I'm seeing words like power in the center. I would agree with that. Stress and food insecurity, taking also that closer to center area. Access, violence, stress. I see environmental racism. And then a range of other pieces: menopause, perimenopause, social dynamics, maternal health, air quality, health hazards, wage gap. So a really wide-ranging, diverse set of health equity concerns here. And they're still coming in, so I'll just give it another moment. Great. So housing is now appearing a little bit brighter. Environmental racism, social dynamics, maternal health, and interpersonal violence, affordability. Okay. I think IPV means intimate partner violence or gender-based violence. I think that's what that acronym is. Great. Okay, thank you. And I see rise of the alt-right movement at the bottom of my screen as well. Thank you for those responses. I really appreciate them. I think it starts us off in a good place to be able to dive into this conversation. So I'm going to actually go to like a kind of a different way of doing things here. We have a number of people here today who are going to help us think through all of these connections between women's health, health equity, and the climate crisis, and of course, poverty. And so what I'd like to do is to call on each of you in turn in the order that's on this screen, just to keep it, to give us as much time as possible for our actual conversation. And we can go, like I said, in the order of the screen, but I'm going to save Mariam for last because she's going to share some special results with us. So let's start with Katie, and then Amber, and then Leanne. And what I'm looking for is for you to introduce yourself, where you're joining from, and I'd love to hear more about the health equity concerns that are a priority for your work or that you're most concerned with. So I'll go to Katie first.
Thanks, Emma. Hi, everyone. I'm Katie Hayes, and I'm an adjunct professor at George Mason University. I'm located in Washington, D.C., although I am Canadian, and I spent about a decade in public health policy focused on climate change and health, specifically researching climate change and mental health. And to answer your question about the impacts of health equity, women, and climate, my research very much focuses on the inequitable impacts of climate change to those already experiencing health inequities, including women, children, Indigenous peoples, people living in low socioeconomic status, the underhoused, et cetera. But really looking at how the disproportionate impacts of climate change on the mental health of women are a key concern. We know that women are often in caregiving roles that are underpaid and undervalued, and so they are definitely at higher risk. So I look forward to the discussion, and I'll pass the floor back over to you.
Thank you. Thanks, Katie. So we're going to go to Amber next.
Thank you. Hi, everyone. My name is Amber Fletcher. I am a professor in the Department of Sociology and Social Studies at the University of Regina in Saskatchewan. I use she, her pronouns. And I'm also a member of the research group, which was previously discussed, and a co-author on the media review paper that's going to be presented in the session today. As a researcher, my main focus is the social impacts of climate hazards, especially drought, flooding, and wildfire, with particular focus on the prairie region and rural and Indigenous communities in the region. My research is guided by a feminist and intersectional approach. And in particular, my research team has strong interest in exploring the impacts of gendered phenomena like caregiving responsibilities on how people experience climate hazards like flooding and drought, and also looking at the gender dimensions of mental health for groups that face significant climate hazards like agricultural producers and especially women in agriculture. So thank you very much, and looking forward to the conversation today.
Great, Amber. That's really interesting work to learn more about. So next we'll go to Leanne.
Thanks, Pema. Hi, everyone. My name is Leanne Lacap. I use she, her pronouns, and I'm calling from Treaty 13 territories of traditional ancestral lands of many nations, including the Mississaugas of the Credit, Anishinaabe, the Haudenosaunee, Chippewa, and the Wendat nations. I am a research analyst at the Center for Addiction and Mental Health, or CAMH, working with Dr. Sean Kidd. And my work focused broadly on health equity research. So I'm interested in understanding how social, political, economic, cultural, environmental factors shape people's health and well-being. And today I'm very excited to speak more about the media analysis paper and to learn from this amazing panel today. So happy to be here. Thank you.
Thank you, Leanne. I'll go to Chelsea next.
Masa, Chelsea Schwenk, Niskani, Gingolf, Wilwit, Gui, Musqueam, Squamish, Tsleil-Waututh, Wuljagai. So hi, my name's Chelsea. I'm a citizen of the Niska First Nation with mixed Niska, Hungarian and Scottish ancestry, and I'm currently calling in from unceded and traditional Musqueam, Squamish, and Tsleil-Waututh territories here in Vancouver, BC. I am a PhD candidate at the University of British Columbia, and my research work focuses on Indigenous health, gender equity, climate justice, and Indigenous self-determination. And I work alongside many Indigenous women, Two-Spirit, and Indigenous youth. I'm also on the National Steering Committee for Indigenous Climate Action, and I work as well with the United Nations Global Indigenous Youth Caucus, along on local boards for youth climate change and setting priorities with youth. And from that perspective, I often think of climate change through a relational lens. When lands and waters are harmed, community health is harmed, when traditional food systems are disrupted, cultural continuity is disrupted, and when Indigenous governance systems are undermined, our ability to care for future generations is affected as well. So these issues are all deeply interconnected, and I'm really excited to have this conversation here today.
Thank you. And Chelsea, I think it's really essential to have you as part of the conversation. So thanks for joining us. I know it's early where you are right now. I'll go to Cheyenne next.
Hello, everyone. My name is Cheyenne Rutnam. Pronouns are she, her, and aval. Aval is the Tamil word for she or her. I'm coming from Treaty 13 territory, more specifically, land covered by the William Treaties, in other words, Scarborough, Ontario, which is a suburb of Toronto. As the screen says, I have the roles that you could see on the screen, and beyond that, I do have other roles, but in the context of today's theme, I am also an advisor of the Canadian Poverty, Health Equity, and Climate Change Initiative. My background has been to do a lot of work within child welfare, homelessness, and interconnected systems. And, when we talk about climate change and health, I think it's important to recognize that climate change does not create inequities. It actually exposes and intensifies and exacerbates inequities that already exist, that a lot of populations have been experiencing, but worse, and that women most affected are often those navigating multiple systems and multiple forms of discrimination simultaneously. And so this includes like Indigenous women, racialized women, migrant women, women with disabilities, women living in poverty, and women who have experienced child welfare, homelessness, or gender-based violence. And so I'm really just excited to be here to be able to bring my expertise, but also to learn from the other experts on the panel as well.
Thank you so much. And so great to have met you through this process. Sue.
Hi there. Thanks, Pema. My name is Sue Shikazi, and I am a health promoter with Lakelands Public Health in Central Ontario. I live and work and play on the traditional territories of the Mississauga and Chippewa Nations in Treaty 20 and Williams Treaties territory, Haliburton Highlands, if anybody's been here. And I want to just give a shout out to all my local public health friends who are online. And I'm sure you'll be able to relate to some of the things that I'll say about our work. We know in public health that wealth equals health. So disparities in wealth mean inequitable health outcomes, and that there's also a number of other factors that influence people's wealth and therefore their health. So things like power structures and racism, colonialism, discrimination that contribute to wealth and health inequities. And then climate change, as previous folks have mentioned, layered on top of that, magnifies and brings to light a lot of those inequities. And I'll just say that Lakelands is also a very rural jurisdiction. And so another layer on that that's another intersection is that where someone lives also impacts their health, their wealth, and some of those other factors. So we work at the intersection of all of those factors. So looking at what are the local impacts of climate change on our populations, and what are how do poverty and structural factors impact people's health, and work at a local level to start to try to address those things, both at an individual, a population, at a community level. So for example, we use a health equity lens on all of the work in our programs and services. We advocate at a local level for policies for healthy communities and work with partners to advocate for healthy public policy at a higher government level. Public health does a lot of communication and knowledge translation to increase awareness of some of these more of the connection between health and the structural issues, and also do a lot of direct service with women who are at greater risk, for example, with pre and postnatal support. So just to paint a bit of a picture of some of the work that we do related to the intersection of all of these issues that we're talking about today. So I'm really happy to be here and looking forward to hearing from all the panelists.
Thanks, Sue. And I really appreciate you taking the time to explore and share with others that public health, the many public health roles and actions at these intersections, because as I mentioned, we have a nice range of people joining this call, and not all of the participants might be as familiar with that public health context. Sorry. So I appreciate that, and we can discuss that further a little later as well. Next, I'll go to Siki.
Hi, everybody. My name is Siki Shui, and I use she, her pronouns. I am a women's mental health psychiatrist at the Center for Addiction and Mental Health and an assistant professor at the University of Toronto. Like Katie, my research also focuses on the intersection of climate change and mental health. And given my clinical position currently, I'm particularly interested in understanding the experiences of women with pre-existing mental health conditions in the context of climate change. And these conditions may include depression, anxiety, and PTSD, and many of the women patients already navigate the realities of poverty, social isolation, and gender-based violence. So I'm really looking forward to today's discussion and learning from everybody to think about collaboratively how we can better support these women and gender diverse communities from a healthcare and health system perspective.
Thank you so much, Siki. And you know what I really love is that this webinar is bringing together all of you and introducing all of you to the many people who are joining. And so I want everybody to really think of this also as a sort of network brokering initiative where, I mean, we are all connected through having attended this. You can share, anybody who's attending can share your contact information or opportunities or resources in the chat. And you're all doing such great work. So I think it's great to be able to meet from these different points in public health, the wider health system, community, and policy and research, and to have this conversation. So thank you. Last but definitely not least, I'm going to go to Mariam. And I wanted to come to you last because you're going to share some sneak peek highlights from a systematic review that you've worked on, focused on women experiencing poverty. And I say sneak peek because it's not yet published, but I'm hoping you can introduce yourself and tell us more about this work and how it connects to all of the things that we've been discussing so far.
Yeah, for sure. Thank you so much. Hello, everyone. My name is Mariam. I use she, her pronouns. I am currently a research trainee under Dr. Kidd's supervision, working at CAMH. And a lot of the research what we do is kind of analyzing the intersection between climate change, health, and poverty. This review specifically is trying to see how climate change impacts the health of women in poverty. Outside of that, I'm also a medical student at the University of Toronto. So the work that we do is very interesting to me because I kind of get to see the health impacts, but also see like what upstream causes are causing these downstream effects that we see in medicine. So today we're going to talk about the systematic review that we led. It was a very large global one. When we were doing screening, we actually had to go through 24,000 over that articles. And ultimately, after lots and lots of screening, we came down to 86 studies that were relevant to our question, which was how do extreme weather events like heat waves, floods, droughts, wildfires, cyclones, and more affect women living in poverty? Can we move on to the next slide, please? Thank you. So across these 86 studies, there were some key findings that we found. Of course, there's a lot of depth to these that is in the actual paper, but for the sake of time, I'm going to keep it pretty brief. But the most common effect that we saw was mental health effects, which was examined across 31 studies of the 86 studies that we studied. So women experiencing poverty reported post-traumatic stress, depression, anxiety, and sleep disturbances. And some of these effects actually persisted for years after the disaster. And recovery was heavily influenced by factors such as social support, housing, and financial security. We also identified gender-based violence and exploitation in about 19 studies, and we found that climate-related events like floods, droughts, and heat waves were often intensifying economic strain and social instability, which was associated with higher rates of intimate partner violence, sexual violence, and in some settings, even early and forced marriages. So the harms were not caused by the weather event itself, but rather by the social conditions that were worsened during these crises. We also saw mental and fetal health outcomes being reported, which was seen in about 18 studies. So heat exposure, floods, and wildfire smoke was associated with preterm birth, stillbirth, and pregnancy complications, with risks often concentrated among women with fewer socioeconomic resources. Physical health impacts were also seen in 16 studies, and some physical health impacts that we saw was heat illnesses, infectious diseases, respiratory and skin conditions, and chronic pain. And a lot of these effects were linked to poor housing, limited sanitation, and barriers to healthcare. Food insecurity emerged in 8 studies where disruptions to agriculture and livelihood was associated with reduced access to nutritious food, and it disproportionately affected women because a lot of women especially bear responsibility for household food provision. Finally, 7 studies examined mortality, showing that women from lower socioeconomic statuses experience higher heat-related morbidity, particularly older women and those living in inadequate housing without access to cooling. So that was a snapshot of the main findings that we found, but I'd like to talk about what's driving these impacts. So, as you may have guessed, the impacts are not caused simply by the extreme weather events. Our review actually suggests that poverty limits access to protective resources, which includes safe housing, healthcare, cooling, and other important factors. And when disasters occur, what happens is that women or other vulnerable populations with fewer resources have less of an capacity to adapt and recover. For example, as I previously mentioned, if there is a heat wave going on and someone doesn't have access to proper cooling within their housing, of course they're going to be at a higher risk of experiencing heat-related illnesses. Gender roles can also increase exposure. Women often carry a disproportionate caregiving responsibility, and they may also be responsible for securing food and water in some settings, which might make them more vulnerable during periods of climate stress. And perhaps the most important finding as we did this review was that the vulnerabilities are very much rooted in structural inequities. And structural inequities do not occur by chance. They're shaped by our policies and systems. Housing policies can influence, for example, who has access to safe and climate resilient housing. Social protection policies determine whether families have support during periods of climate stress. And healthcare policies dictate who has access to important healthcare resources, especially women who might need access to maternal and health services. So in other words, extreme weather events act as a threat multiplier. They expose and worsen inequities that are already present. And so because of this, it's important that we're not just responding to disasters. Instead, we need to address the upstream causes of these drivers of inequity, which might be tackling, policies that address poverty, strengthening social protection, improving access to healthcare and housing, and ensuring that women are included in climate adaptation and decision-making processes. So ultimately, vulnerability is not this inevitable consequence of climate change. It is very much shaped by social conditions, and a lot of these are modifiable. And we hope that by addressing these upstream determinants, we have an opportunity to advance both climate resilience and health inequity. I know that was a lot of information that I tried to condense within the time that I had. If you have any more questions, please feel free to email me. And we hope that once the review is published, we can send it out to the network.
That was amazing. So thank you. That was a lot of information, but all really good information and very clearly explained. So thank you so much. I just wanted to sort of echo what you said there, that that there's so much to think about in terms of those upstream determinants, about how society makes these choices and how much of this is modifiable. And I just wanted to encourage everybody to, if you haven't already had a chance to check it out, we do have a Let's Talk document that explores this that I think pairs really nicely with what you've just shared. And so you can scan the QR code or find it on our website, or Carolyn's shared the links. We also have a new Let's Talk on the concept of moving upstream. So you mentioned that. I don't have a QR code here for that, but you can find it on our website. So I think after all of that great information, I'm going to pause actually and come to this in a second. But I wonder if anybody in the group of speakers has any kind of reactions that we have a little bit more time than I thought, which is amazing. Does anybody want to react to what Mariam has shared, to what was found in that research? And if you do, just unmute and go for it. And if there's nothing, that's okay.
I'll dive in. I just wanted to say, Mariam, that was a really wonderful overview and just really highlights the impact on women's mental health related to climate change, which for a very long time has been overlooked and understudied. There's been a lot more research lately in the last couple of years really highlighting the impacts to mental health. And I think that's really important, and particularly when we're looking at the structural determinants of health and thinking about the policy drivers that need to take place. And the role for women in decision-making roles and for women who have lived experience at the policy decision-making tables. I think that's really exemplified in your research, and thank you for sharing that.
Thanks, Katie. Fully agree. Does anybody else want to share anything?
I would like to say something or a response in terms of the gender-based violence and intimate partner violence aspect that this review has shown us, because I think what the review has identified is very much reflected in what I'm facing day to day as well, working in a psychiatric hospital. What I'm seeing is that women living in poverty may already have greater dependence on their abusive partners with fewer options for relocation. So during extreme weather events, they may have to be forced to choose between exposure to the elements or navigate a shelter system that they're not familiar with and be potentially dangerous, or choose to be sheltered and housed, yet be with their abuser or in a psychological unsafe environment. So sometimes we do see women having no other ways or places to go except to come to the emergency department or come to the psychiatric inpatient facilities, because these difficult choices would have very serious implications for depression, anxiety, trauma, as well as substance use, or the retriggering of some of these symptoms as well.
Yeah, thanks, Siki, and I appreciate those insights. You're in a really specific place within that health system intersection where you're seeing some of these impacts. So thanks for sharing. Right.
If there's time, Pema, if I could just add on to that. I'm really grateful to Siki for highlighting the gender-based violence dimensions of this review. And thank you, of course, to Miriam for doing this important work. One of the things I also wanted to note is that for women who do make it into the shelter system, who have experienced and survived gender-based violence, intimate partner violence, I don't think we collectively as a society have paid enough attention to how to safely evacuate women's shelters, because there are reports, there's still emerging research on this, it's small scale research at this point, but there are some reports that women have been evacuated when the shelter is evacuated, that women survivors have been taken to the same evacuation centers as the perpetrator of violence. So I think we have to think really carefully about evacuation strategies that are trauma informed, especially as the cause of evacuation continues to increase due to climate change. So just wanted to add that as well.
Thanks, Amber. I really appreciate everybody's perspectives on this. Chelsea or Shan, I can't see you on my particular screen here, but if you wanted to unmute and say anything, go for it. And if not, no worries.
Yeah, I think we see it often that like Indigenous voices and especially Indigenous women's voices are really underrepresented in the media and like around climate change and health equity. But when you were sharing the findings, it actually made me think of this recent Indigenous stewardship and conservation approach in this study from UBC, which is, I think it's one of the largest studies in terms of like conservation and protecting climate change that's happened in the past couple years, but it showed that like Indigenous-led conservation efforts are the most effective approaches for protecting biodiversity and sustaining healthy ecosystems, including human health and the health of lands and waters. So yeah, supporting Indigenous governance is therefore it's not just like a matter of reconciliation and rights. It's also like an evidence-based strategy to support our environment and the health of women. But thank you for sharing, yeah, this wonderful work.
Yeah, and thanks, Chelsea. That's a great reframe. That it's not just, it's evidence-based. It makes good sense for lots of reasons. Okay, thank you.
And I think in terms of what I wanted to add to that as well is I think we talked about this already, but maybe provide some language around this. I believe we need much more attention to trauma-informed engagement and strategization. Many communities affected by climate change and climate crisis have also experienced displacement, migration, institutional harm and violence, or intergenerational trauma. Whether we are conducting research, designing services, or communicating public health information, we need approaches that recognize these realities rather than treating them or treating climate change, I should say, as an isolated issue. And also, like one thing that's also overlooked is the connection between child welfare, homelessness, housing instability, and health. We know that children and youth who experience family separation, foster care, group homes, or housing instability are at increased risk of poor health outcomes throughout their lives, from conception all the way up to old age. So climate-related stressors can further destabilize families and communities, yet these systems are rarely discussed together. And I think last week I came upon a statistic from research that shows that during hard times, mothers are more likely to have girl babies. So gender plays a huge role in all of this.
Such interesting things. Thank you. Thank
If
you,
I could
everybody.
if I could just add something, Pema, also, because I was just thinking as Mariam was presenting the top, there were the most articles related to the impacts of poverty and how climate change really worsens the impacts that we know are as a result of poverty. So things like, people living in poor housing because they can't afford appropriate and adequate housing, and experiencing food insecurity, which also came up in the word cloud as something that women experience. And so it just, to me, highlighted how important looking at root causes is, and how income is at the root of so many vulnerabilities that people can experience during climate related events. And so solutions that are, looking at income-based solutions is a really important sort of big picture solution that I think, I know in public health, we think about a lot, because it's at the root of so many of the health issues that we see in our communities.
Yeah, and Sue, hang on to that thought for when we get to our sort of third round of discussion, and talk about some of those upstream solutions. I think what I'm getting from this conversation, and what we might get as we talk about the media kind of environment, is doing more of connecting those pieces. So income, various different policy solutions, the many different impacts of the climate crisis, and what women experience. So I think I hear you on all of that, and I hold that thought. I think it'll be really useful later. So I'm going to move us to this next piece, which is coming back to all of you. Again, it's another one of these polls. I want to ask again participants and speakers to get out your phones, scan that QR code, and tell me about the stories that you most often hear about. So think about the media that you consume. This might be on Instagram, it might be in a newspaper, on a blog, radio, television. What do you hear most? Another way to think about this is those sort of dominant narratives. All right, I see climate disasters, displacement, heat waves, so they're coming in fast. Air quality denial, yeah. Economic impact of acting and not acting. Environmental destruction, seniors, heat records, flooding, fire prevention. Okay, so we're seeing some themes emerge here. The wonders of technology, it groups them at the top. So we're seeing wildfire has had 5 responses, damage 3, and impact. Not sure what that one means, but 3. Property damage is getting some traction as well. So what we'll do is when we share, the recording, the resources, and all of that with you, we'll share this as well. So you can have a look at these responses more completely, because I realize that they're going by too fast to catch all of them. Increased violence, lack of job opportunities. So you're hearing a lot. And I think this next mini presentation that we have lined up from Leanne is going to add into that conversation because, okay, government support sensationalism, lack of job opportunities, lots there. So I'm going to ask Leanne to get ready, and I'll ask you one more question before Leanne comes on. I want to know what you want to see more of. So that's what you're seeing. Is there anything that you'd like to see more of? And there might be some journalists on the line here too, or some people from the media who listen in later on a recorded episode. So this is your chance to say what you want to see covered. Tax the super rich, policy changes, mitigation actions, stories from those impacted the most, nuance, government investment, more talk about root causes, the intersecting benefits of some of the solutions, success stories of resilience. Yes, I'm really seeing a lot here that resonates. And the themes are sort of actions, solutions, stories, and change efforts. Reduce misinformation. Okay, thank you very much. That's super helpful and good framing for our conversation. So again, we'll share all of this back with you. I'm going to ask Leanne to join us on camera here, and she's going to do, I'm sure, an amazing job because she's put together some amazing information here to help us think about this even more. Leanne's been involved with a study called Women in the Midst, an intersectionality study of Canadian climate change, poverty, and health media reporting. And the link to that is in the chat box, and you can contact Leanne for more information.
Thank you, Pema. Next slide, please. Perfect, thank you. To set the scene, so this study examined how Canadian print media covered the intersection, climate change, poverty, and women's health over a 9-year period, so from 2015 to 2024. And after screening nearly 1,800 articles across 2 major databases, so we arrived at 69 for analysis, and we coded them using a combined framework. So the journalism 5 Ws alongside critical frame analysis, which allowed us to look not just at what problems were identified, but what solutions were proposed and whose voices were driving the conversation. Next slide, please. Perfect, thank you. Quickly on the findings. So on who was covered, so pregnant women dominated around 30% of articles, but women with disabilities were largely absent. Indigenous and rural communities were also significantly underrepresented, a gap that matters because we know that underrepresentation in media could become underrepresentation in policy. So on timing, coverage spiked around major climate events like the 2021 Western Heat Dome, then dropped off sharply between them. We see this as reactive, not sustained. But the most striking finding is what happens when you place the problem framing and the solution framing side by side. Problems were diagnosed as deeply systemic structural inequity, unaffordable housing, discriminatory labor markets, Solutions were more varied. We have government level interventions. So, for example, policy reform, investment in women's education, sustainable energy investment. We also have individual level advice, stay hydrated, buy an air purifier. But here's the mismatch. Here's the issue. Even the government level solutions largely addressed symptoms rather than the structural conditions producing the problem. And across all levels, women were rarely positioned as leaders or co-designers. Solutions were often developed for women rather than with women. Next slide, please. Thank you. So now we ask the question, so what? Why does this matter? So my apologies, I think this one isn't on the slide. But first, when solutions, even well-intentioned ones, address symptoms rather than the structural causes, I know we were talking about the root causes, the underlying conditions that make women vulnerable remain intact. Investing in infrastructure matters, that's important. But it does not dismantle the commodified housing markets, for instance, profit-driven energy systems, exploitative labor markets. And we should be clear about what those systems are built on: racial inequity, gender oppression, colonial dispossession of indigenous lands, among others. This was mentioned by Cheyenne, but climate change does not create these vulnerabilities. It exposes and amplifies oppressive systems that were already there. So treating the symptoms while leaving those roots untouched means that the same populations, women and others, will remain vulnerable through the next disaster and the next one after that. So second, reactive reporting actively works against the systemic change these issues demand. So a while ago during that Worldly, we're looking at some answers about who are the most impacted, right? But when we think about the coverage, so coverage spiked around disasters and fell away between them, which means these intersecting crises were treated as isolated events rather than ongoing conditions. So that framing has real consequences. When the urgency disappeared with the headlines, so does the pressure on decision makers to act. And third, consistently framing women as recipients or beneficiaries of solutions rather than as agents and leaders reinforces the very inequity the coverage claims to critique. So if women are never positioned as co-designers of climate responses, the reporting, however well-intentioned, ends up reproducing the same power imbalances it describes. And as we know, the solutions that emerge will continue to fall short. So next slide, please. So now we ask the questions, now what? So first, media coverage needs to move from reactive to consistent, from event-driven to systems-driven. So framing women's climate health challenges as isolated disaster stories lets structural inequities remain invisible between crises. So we need to have sustained and intersectional reporting, and this will also keep pressure on decision makers. So second, women, particularly Indigenous women, low-income women, women with disability, and those most directly impacted, need to be present in coverage as leaders and co-designers, not just as quote-unquote populations at risk. So their knowledge and lived experience are not just a footnote in a newspaper article. They are the evidence that there is a need for a more rigorous climate policy, that is missing. And third, and most concretely, intersectionality needs to become a design standard in policy development. And we already have tools to do that. For instance, we have gender-based analysis plus framework that exists precisely to assess how policies affect people differently based on gender, race, class, and other identity factors. So the question now is whether that's being applied rigorously and early enough in climate planning. And beyond that, we also talked briefly about what Chelsea shared, so Indigenous-led climate adaptation plans that offers a model for what it looks like for when the people most affected are actually driving the response. So I'd like to end by saying that every system that has been dismantled was first named and named consistently, not just during times of crises. And when we do this often enough, ignoring it becomes impossible, and hopefully action will follow. So thank you so much.
Thank you very much, Leanne. That was extremely informative, and it makes me want to go and go back and read a bunch of different pieces and sort of analyze them through a different lens. So thanks so much for that work. I think it's a real contribution. Um, and it pairs really nicely with the work that Mariam shared and with all of your insights as a group of panelists as well. It strikes me that media reporting can really range from helping us as people who consume the media to understand the problems, understand the climate crisis, what causes it, what we can do about it. Um, and it ranges then to also understanding the solutions. And we got to that in some of the discussion before. Um, some of the problems are so intersectional and systemic, like racialized, gendered, income inequality, and how that can make one more vulnerable to extreme heat, for example. But then the solutions that are highlighted, particularly in the media, can be at different levels, can be individual or community. But I don't see the systemic as much, and I think that gets to what you spoke to, Leanne. So I think at the same time, there's a real value in that kind of immediate meeting the basic need work that is shared through popular media channels, like guidance to visit a cooling center or stay out of the heat or donate an air conditioner to somebody in need. So I'm myself sort of working through that need for balance in the coverage, meeting the current pressing needs, and then highlighting and centering women in leadership and in solutions. So, I'm interested to hear more about everybody's thoughts on this, about opportunities to improve how the media reports on these topics. And I want to go to Chelsea first. One of the recommendations that Leanne shared was for policy and media to elevate the knowledge and leadership of women, particularly Indigenous women. And you've already spoken a little bit to that. I'm wondering if you have any further thoughts that you'd like to share.
Like as mentioned before, like Indigenous women certainly experience disproportionate impacts of climate change due to historical and ongoing systemic Indigenous specific racism and violence against women. And that's, well documented globally through the United Declaration on the Rights of Indigenous People, and then also here in Canada through the National Inquiry into Missing and Murdered Indigenous Women, Girls, and 2S LGBTQIA plus people, as well as through other documents like the Truth and Reconciliation Calls to Action. But at the same time, like many of our Indigenous communities here in Canada are matriarchal, where Indigenous women are also our leaders, there are innovators, there are decision makers, there are stewards, our water protectors, and our knowledge holders who are actively responding to climate change every day on community and international levels. And so there's many Indigenous women leading efforts to protect biodiversity and revitalize traditional food systems and protect our community health and wellness. And often, like the media coverage focuses on climate disasters, which is so important, and Indigenous women's vulnerability. But we often overlook the systems that shape vulnerability, including colonialism and poverty and environmental racism and gender inequities. So I'd like to see more stories that connect climate change to Indigenous rights, to like gender equitable systems and self-determination and health equity, and really advance community-led solutions. One of the like stories that's coming to mind is I was recently involved in some BC First Nations youth, women and Two-Spirit people who came together to set some climate change priorities for NBC. And it's really powerful when there's funding and space given to Indigenous women and youth to be able to come together and collectively support our rights and create solutions. Because these solutions support redistributing power and recognizing and restoring systems of care and governance that have sustained Indigenous communities for many years. So I think about this as like rematriating health. So going back to the laws of the land and really restoring like the interconnectedness between people and climate change, and restoring the relationships and responsibilities and the way that really we as a society care for one another in this world. And I'll just like plug in one other thing. I think gender-based analysis was plus. was mentioned. So there is an Indigenous gender-based analysis plus toolkit as well, which I can add in the chat, but it has this really wonderful basket methodology, which talks about how to like really meaningfully implement and uplift Indigenous women, girls, two-spirit, indigiqueer, and gender diverse voices within research and policy. So I can link that in the chat, but yeah, definitely something to like integrate into our work.
Thanks, Chelsea. And so much of what I'm hearing extends, beyond that media stories told in the media to also the way we tell and integrate stories into our work in public health, into research, into community-based work and policy advocacy. So I think there it resonates, in a broader way in terms of how you'd like to see those changes in storytelling. Shan, what about you? Do you have anything that you want to add to this conversation?
Yeah, so what resonated most for me was how often the intersections were missing. So people obviously do not experience climate change separately from poverty, migration, housing, child welfare involvement, or health challenges, yet much of our media coverage still treats these as distinct issues. And in the word brainstorm that we did earlier, we saw so many different words pop up, right? So wildfires, maybe carbon reduction strategies, and green technologies. However, the media focuses on the environmental impacts, but they are structural. So they include inadequate housing, poverty, systemic racism, sexism, colonialism, precarious employment, and policies that leave some communities with fewer resources to adopt and adapt to or recover. And media focusing on environment outcomes fails to explore how climate change intersects with poverty, migration, housing, gender, and health. And I was particularly interested in thinking about whose voices were absent from reporting. So were climate migrants represented? Were women who have experienced homelessness represented? Were aging women represented? Were women with lived experience of the child welfare industry represented? Were Indigenous women represented? And all these populations are not homogenous, right? There is diversity of identities and experiences within these umbrella populations. And so these perspectives can fundamentally change how stories are framed and what solutions are proposed. And I was also struck by how little attention is often given to systems navigation. And many people experiencing climate-related vulnerabilities spend significant amounts of time navigating multiple systems simultaneously. And this includes all the systems that I that I said over the last couple of questions. And what I would like to know more about is how media narratives shift when lived experts are involved not only as sources, but as journalists, editors, researchers, and decision makers. And in my experience, communities bring a level of nuance and accountability that is often missing from mainstream coverage. And so one thing I really appreciate about grassroots and community journalism is that it often does a better job of telling these intersectional stories. It tends to center lived expertise and ask deeper questions about systems, power, and accountability. And I am fortunate to be the assistant project manager of Spotlight Child Welfare, which is a national collaborative of journalists across the country, who majority are grassroots newsrooms and grassroots journalists, which engages with lived experts and communities to improve reporting on child welfare in the country. And I can see in real time the opportunities that exist in grassroots journalistic spaces. And what I would like to hear more of are stories about climate migration and displacement. Climate refugees are often discussed as a future possibility, but they're already here. It's already been a reality. And we need more reporting that explores what happens after arrival, how people navigate racism, sexism, housing shortages, healthcare barriers, and poverty while attempting to rebuild their lives as well.
Yeah, fantastic insights there, Shannon. I think we need to bring some of this conversation to those grassroots journalism spaces as well. And I love that you're connected in so many ways with that work. So thank you for bringing that into this space. And it makes me think about, people like Sue who work in health units, and how health units often issue press releases and work with different people in the media to get out our needed health-related messages, or to be in support of an initiative, but in a more public-facing way. And so it makes me wonder, given all that we've heard from Chelsea and from Cheyenne and from what Leanne shared, what would you like to see more of in those efforts, Sue?
Well, it certainly struck me in the word cloud and also in just the media that I follow that it's true. I think that most of the impacts relate to the environment or the physical infrastructure. We hear about roads washing out or culverts being overcome and flooding that impacts people's physical dwellings and those kinds of impacts, which are obviously significant. But there is much less prominence placed on the human impacts, whether it's displacement or mental health or the health impacts. And I think that there's still largely the understanding of climate changes as an environmental problem, crisis, when it's also just as much a health and a human crisis. Like we can't separate. I don't believe we can separate the environmental aspect of the crisis from the human aspect. And so one of the things that I think we're working towards in public health is making that connection that climate change impacts people. It's impacting human health now, individually, at a community level, and globally. So that's one piece. And I think practically speaking, for those of us that work in public health, yes, a big part of our work is communication and knowledge translation. And so as I've been listening to people talk, it really made me think about like how can we build on what we currently do and the current relationships that we have with media partners, especially since lots of us work in smaller communities. So we have potentially an opportunity to connect with our local media partners. I guess if we still have them, because lots of small communities don't have them. But in between those crisis events, when that's what's in the media, excuse me, um, can we, I guess, build on those relationships and start to uh, work with media partners to tell stories that are stories of resilience and exploring strengths of some of the people who are impacted and some of those bigger picture and more structural connections, I guess, between climate change and the impacts that we see, so that it's not just, wow, we had this flood and look what happened, and then 2 weeks later we've moved on, but also, okay, who was really impacted and how and why, and what does that mean to us as a community and as a society to address some of those structural causes. Because I think the other piece of media coverage that's important is if we can start to communicate about poverty as uh, a system and a structural issue versus an individual problem, then we start to be able to address the stigma that's often attached to people who are living in poverty, where it's an individual problem. They just need to, pull up their bootstraps and that sort of thing, versus the system in which people live and the factors that contribute to them living in a situation where they're in poverty, and then the associated health challenges that come along with that. So that's another piece as well.
And so you mentioned that building relationships piece. What I take from what Cheyenne and also Chelsea were mentioning um, is is that in that looking for relationships, the relationships with the right people and the right work, with those engaged in that kind of grassroots journalism effort with the people, particularly Indigenous women who are leading such important work in so many different sort of climate change impact areas. And so I think that putting all of those together can be really powerful. Thank you. I want to make sure we have enough time to talk about the next question. And so I'm wondering if we can move into that, but continue to comment on how media coverage can include, because can improve, because we've already heard a lot of really good stuff on that point. And our next question to explore together is, and these are just related resources. Sorry, I won't say much about this, but there are some related podcast episodes that really do that reframe from what is the real risk factor, and reframing to colonization, oppression, and racism as risk factors. So Carolyn will share those links in the chat. We don't need to say more about that here. But I just wanted to move to ask, if you had to name one opportunity, and we can go to everybody for this, to advance health equity for women experiencing both poverty and the climate crisis, what would it be? And again, if you want to weave in how you change media pieces, that is fine. But maybe we'll just keep going through the group here. So we've heard from Chelsea and Cheyenne and Sue. So what about Amber and then Siki and then Katie?
Sure, thank you. It's hard to pin down one opportunity because I think as the review showed, we have many opportunities. I want to actually just highlight one of the ways in which I was pleasantly surprised by the results of the media review, the Women in the Midst review. And that is that I was actually expecting to see far more emphasis on biophysical aspects of health and the poverty climate change intersection. So the fact that there was attention to the social determinants of health, to things like income disparities and gender-based violence and caregiving, I had expected to see actually less attention in the media to those social dimensions. So of course, as everyone has highlighted, I think we need much more attention to the deeper pervasive structures, colonialism, patriarchy, neoliberalism that cause these social dimensions. But I was pleased to see a recognition that gender is not reducible to sex, that gender involves contextual and systemic and structural factors that really do shape how people experience climate change and climate hazards. So I would like to see a continuation of that emphasis and not a recognition that biophysical health impacts are very important. Yes, maternal health, pregnancy. But at the same time, there is so much more to the gender dimensions than the sex dimensions. So to prevent that reduction. And I think if I could just sneak in one more opportunity, I know you asked for one, but I'm going to cheat here. And I think where some of the conversation has pointed us today is really to the importance of public accessible social safety nets. Several people have mentioned income supports. I think Sue mentioned that. And I think we have to recognize that climate change is going to cause disasters that far exceed the coping capacity of individuals, families, communities. We need to see adaptation and response as a collective responsibility. And I really think public supports for disaster assistance, drought, flooding, the improvement of wildfire response, all of these things really have to be a focus going forward, because it's not just, as other speakers have pointed out, it's not just the individual responsibility of get an air conditioner for your household. So we need to make this a public responsibility, and we need to invest in that collectively. So thank you.
Thanks so much. Great insights there. We go to Siki and then Katie.
Yes, thank you, Pema. Something I've been thinking about, actually in response to our discussions around the media analysis, is the lack of inclusion for women living with disabilities. When we think about disabilities, people sometimes have a dichotomy of mental health disability or physical health disability, but they often go very much hand in hand. When we think about depression, anxiety, they often have a greater prevalence among females, and some of the more weather sensitive physical conditions, such as arthritis or migraine headaches or chronic pain, are very much more prevalent among females and women as well. And these physical conditions are often also more stigmatized in our healthcare system. So I really think in order for us to make further strides in coming up with solutions and in media narratives is that we include more voices, such as women living with disabilities, as our analysis has pointed out, so that we can come up with more tailored and people-focused solutions. I also agree with what Sue mentioned about celebrating women's intrinsic strength as
I seem to have
well
lost.
as having more resilient-based portrayal. Oh,
Yeah, we
sorry,
lost
am
your
I
sound
still
there for
here?
a little bit, Siki, but I think we got most of it.
Sorry. Okay, I would just, in case my internet drops, I will make one brief point about resilience-based portrayals, because I think on one hand it's very exciting to celebrate women's strengths and at the same time not to uniformly portray women as these virtuous giving beings, and that they're environmentally conscious and they're protecting others and building community resilience, or unintentionally assign women all the responsibility of solving our climate problems, especially for women living with disabilities, when in this cross-sectional time, they may not have the sense of control and capacity, but they have that sense of responsibility that could lead to more psychological burden, shame, or guilt. So I hope that there could be more of a balance to not unintentionally normalize the unequal emotional, cognitive, and caregiving burden that women already perform in our future discussions and in media narratives.
Yeah, that's an interesting and good nuance to bring into the conversation. Thanks, Siki. Chelsea, I see you nodding. Did you want to jump in there?
Yeah, I think like I had mentioned, earlier that I think we need to like really invest in Indigenous women and Two-Spirit people and youth as climate leaders and decision makers. And I also mentioned earlier, about that UBC report that was posted in the chat, that we really need to recognize Indigenous stewardship as evidence-based climate and public health solutions. And the one last opportunity that I was thinking about is that we need to move from commitments to implementations. We have important frameworks outlined, like the United Declaration of the Rights of Indigenous People, as well as Sustainable Development Goals. And the path has been laid before us here. And so it's really about ensuring that governments and institutions and systems are taking meaningful action to implement these commitments in partnership with Indigenous people. And I really like the last point too about bringing disability into this too. It's not about putting all the work on Indigenous women, but we all have an obligation to support our healthy futures. And the path is here with calls to action, and it's time for us to implement them and hold our systems accountable.
Yeah, I agree 100%. Thank you. Thank you so much, Chelsea. Katie.
Yeah, and I was actually going to pick up on a point that Chelsea had made earlier, and I'll tie it into what Siki just mentioned. But I do think, one big thing is funding for this work that is led by women. I mean, so often women are the community builders, and we are the ones creating those social connections. And we know that social connections after climate-related weather extremes are more important sometimes than financial assistance. Obviously, we need both. But women's unpaid work continues to drive this community building. And Chelsea made the point earlier, funding women in this role and children and youth in doing some of these solution-oriented work. But again, providing opportunities, not putting more pressure on women to take on these additional roles. But if they are going to take on these additional roles, that there's funding and leadership opportunities available to them, especially in decision making, especially in any forums where governance is needed, is ensuring that there's nothing about us without us as an approach to driving this work forward. So just really appreciate all the thoughts that were shared by everyone, and just a lovely dialogue with all. Thanks.
Thank you. Yeah, I couldn't agree more. Shan, did you wanna jump in here?
I think everybody kind of alluded to this. And I think one of the biggest opportunities is to move away from siloed approaches and towards systems level solutions. So, from a practice perspective, for example, trauma informed and culturally responsive approaches should be foundational, whether we are working in healthcare, public health, settlement services, housing, or social services. We need to recognize that many people are navigating histories of displacement, institutional harm, systemic discrimination, and effective engagement requires trust and cultural humility and meaningful participation. And the reality is that for some women, climate emergencies, extreme weather events, or prolonged periods of social isolation can become life and death situations, particularly when they are trapped in unsafe homes or living in poor environmental conditions. And to go along with that, from a policy perspective, I think we need to ask harder questions about the laws and policies and the systems that perpetuate inequities in the first place. When we talk about climate resilience, we should also be talking about housing adequacy, tenant protections, income security, immigration policy, and access to healthcare as well, because these are climate issues because they determine who is able to withstand and recover from climate-related events that exacerbate their everyday issues as it stands.
And I think this picks up on that opportunity for people within health and the public health system and in any really of those policy influence spheres, whether that's from academia or community-based work, is drawing those connections and saying immigration status, it's a health issue, it's a climate issue, it's a both issue. And I was just picking up on one of the pieces that you shared, but there's so many ways to frame the multiple dimensions of any of these political issues, none of which are single issue. So thank you so much for bringing that into the conversation. Mariam and Leanne, I know that you spoke about your work and you shared your work. I just wanted to call you into this space and say, do you have anything that you would sort of pinpoint as the one thing that you'd like to see happen, the opportunity that you'd like to advance? I'm seeing you nod, Mariam. Why don't you go first?
Yeah, thank you for asking, and thank you everyone else for sharing. Those were all wonderful insights. I think the thing that I'm going to say is kind of, again, what I mentioned in my presentation, which is really broad, but I do think it's really important for us to address the structural determinants rather than seeing climate response as something that happens after a disaster, but rather instead, integrating gender responsive and equity focused approaches within actual health systems to ensure that people who might be vulnerable have access to healthcare that is accessible. They are living in, climate adaptive housing. And I think prevention is always better than cure. So addressing those upstream causes, I think, is very important, which is really broad, I know, but it's just there's so many things I think are important that's hard to just mention one thing.
And it aligns with that systems focus that Shan and Chelsea and Katie and others have shared in this space. So I mean, I think that what all of you are saying is converging at that action implementation at a upstream system level is needed with the necessary sort of nuanced perspectives and thinking that all of you bring to this conversation. Leanne or Sue, did you have anything that you wanted to share before we move to questions?
Sure. I think I just wanted to reiterate what I mentioned about this is just one opportunity. There's a lot of opportunities as mentioned, and I do agree with the amazing panelists here. But wanted to reiterate that one opportunity is to move from that consultation to co-design. We're talking about making women leaders, but also making sure that they are not just being invited to the table as I think the common what's happening that they're just being invited to the table after the decisions have already been made or already been shaped, but actually them being at the very beginning and seeing the entire thing as it happens. Thank you.
Thanks, Leanne.
And I'll just add, Pema, I think it was I just wanted to build on something I think it was that Cheyenne said, and that is an opportunity to really communicate the multi-solving or co-benefits of different policy or upstream solutions, because I really think that that helps with the buy-in from decision makers, from policymakers, and from the general public. When you see, for example, that when we're advocating for more green space and more trees and greener infrastructure, that it's good for climate mitigation, it's good for heat mitigation, it's good for air quality, it's good for mental health, physical activity, all those kinds of things, so that investments in certain solutions benefit many people, including women. And so I guess that would, sort of go along with something that was in the research that said, so, talked about the benefits, that systemic benefits benefit women, but they also benefit everyone.
Yeah, and you're getting some good heart reactions for that. Sorry, I said everyone with you, but I was on mute, so you just probably just saw me go like this. Um, so we do have one question that's come into the chat. I'm going to give people a few minutes to type into their question. Sorry, not into the chat, into the Zoom Q&A function. And I'm going to also, just in the meantime, just advance this piece so that you can see, the people who are on the line can see. We have a bunch of related resources. I will share these in and Carolyn will share these. Carolyn's our webinar lead. We'll share these in the materials that go out after this webinar, as well as everything else that's been mentioned. But we have a climate practice brief that goes over some of these public health roles and actions that I think might be worth looking at with the thinking that we heard here today. We also have a Let's Talk series. A few of those resources have been mentioned throughout this piece. There's a Let's Talk on determinants of health, power, and redistributing power, which is something that I heard several of you talking about. A basic one on health equity, another one on intersectionality. So if this is an entry kind of level conversation for you and you want to dive deeper into different topics, this is a good place to go. And there's also a Determining Health series, which has some really meaty evidence briefs in them. We call them issue briefs. One's on migrant health, and there is some work in there on migrant farm workers, migrants in different contexts experiencing extreme heat, looking at public health roles, looking at inspection work, and how we could improve some of those guidelines around maximum temperatures for housing standards. So I encourage you to have a look at some of those, because if you're interested in some of these intersections with climate, determinants of health, and equity, you might find some more information in here. Okay, so I'm going to exit out of these slides. So the question I want to ask, and this could be for everybody and anybody, so feel free to jump into it, is this is from Shania Denell, who is a municipal climate intern. And they're asking, do you have any practical ideas on how municipal government can implement climate action with women's health integrated? I have found that the two are often approached separately. Anybody want to venture into that municipal action area?
I can jump in. I mean, this is a small answer. There's multiple answers that can be had for this question. For me, this goes back to who is missing from the discussions and decision making. Many climate consultations, for example, primarily engage environmental stakeholders, but we need municipalities to include spaces, groups, and people who see climate impacts before planners do. So this could be women's shelters, sexual assault centers, immigrant and refugee serving organizations serving racialized women, disability advocacy groups, etc. And one thing that I know for sure that a lot of people are experiencing in Canada right now, at least in Toronto, and the GTA, is the increase of allergies and asthma. So we're seeing emerging climate crises in real time, right? And the issue of tree planting, right? So So a lot of municipalities have planted male trees, and without female trees, there's going to be more pollen in the air. So also planning around planting female trees, even though trees are not like human women, like they are part of the equation as well. So these are two ways, two little ways of making sure that women are the center or prioritized around climate crisis and climate change planning.
I was just going to say, here, Cheyenne. I also agree with you. I live in Washington, D.C., and the same issue extends here, and it's an unintended policy consequence. The other thing I just wanted to highlight, my time at Health Canada, we collaborated with the WHO and also have a Health Canada climate change and health vulnerability and adaptation assessments that many municipalities use. And this is really built upon the framework that early engagement in the assessment process of climate risks, who's most at risk, why, who needs to be at the table in terms of policy and adaptation opportunities. So with a real SGBA plus health equity lens to it. So I can pop that in the chat as well, links to that. When I was with Health Canada, there was funding for municipalities across the country, and there's examples of that work that has been done as well that I can pop in the chat too. Thanks.
Thanks, Katie. That's great if you can pop that in the chat. Anybody else have any answers to that question on municipal action? I think it's an interesting piece. And I mean, I'll just say this because people might be interested. We do have another podcast episode, same person that was highlighted in one of those quotes. So it's Dr. Imara Ajani Rolston who's featured, and he works out of Toronto in both a policy role with the City of Toronto, so municipal, and in another role with the Community Climate Resilience Lab, looking at the intersections of racial justice and climate justice. And one of the things that Imara talked about in that episode, this is season 2, episode 4, if I'm not mistaken, was that, he was working in the Confronting Anti-Black Racism unit for a while of the City of Toronto, the policy unit. And then in another part of his time working in a resilience sort of climate role. And that those two roles or groups didn't really talk to each other or work to each other, or speak, but they do go hand in hand in so many ways. And so I think another practical, this is my jumping in, but I mean, another practical way that you can advance municipal level work that has a good women's health and equity lens is to actually talk to your peers working in different parts of especially a large health unit, where really important work and thinking might be going on issues that are very interconnected but aren't often connected. So like aren't often intentionally connected through work plans, through work assignments, etc. I saw Katie nodding, and Katie's also had that sort of health unit experience. So
yeah, and I that's a great point, Pema. I think in public health, we have our own silos within our organizations. And so we need to be mindful of that and making sure that we're doing work across our programs and services. And Shania, I would say that I'm not sure what municipality you're with, but if your municipality has not connected with your local health unit or health authority, that would be a great place to start a conversation about how to connect their municipal climate work with health and women's health in particular.
yeah, that's a great point. Any last words from any of our amazing? I just want to say I'm so grateful to all of you for joining this conversation. Thank you very much. Your insights are invaluable. I see Sean has come on. Sean, do you want to say something?
Yeah, I wanted to take a moment, Pema, to thank you actually, and the Collaborating Center, as well as Maria Belna Miller. There's been a lot of work going into pulling this all together. I think this has been fantastic. So deep thanks to you, as well as all of the panelists here today.
Yeah, thank you. And I'm seeing a lot of appreciation go up there and those funny reactions from Zoom, and right back at you. And it's been great to work with all of you and with Maria particularly on this, and wishing everybody on this call all the best. And I hope that we can continue these conversations. So thank you. Have a great afternoon, everybody, or morning, continued morning to those joining from the West Coast.
Thank you.
Thanks so much. Bye-bye.
Bye, everyone.